Well, good afternoon, everybody, and welcome to our breakout session titled The Work of Being a Patient. I'm Elena Janot, and I'm the Vice President of External Relations here at NCCS, and I'm really excited to introduce the presenters for this session, Richard Gelb and Lynn Zakelin, who are members of our CPAT program and who really work tirelessly to make sure that the patient voice is heard. Incidentally, Richard was probably one of the first people I ever met right after I started working at NCCS. We met at an ASCO symposium, and he just really struck me as someone who cared so much about the work that we were doing. It really has stayed with me for years, and he and Lynn have been great friends to NCCS, so we're thrilled to have them here. Richard's a cancer survivor, an advocate, and was a caregiver. In 2017, his abstract entitled The Job and Work of Being a Cancer Patient, How to Advocate for Self and a Loved One, was accepted to AACR's Scientist to Survivor program. And he's also served as a grant reviewer for the Live Strong Survivorship Grant Program and is a cancer support group leader at the local American Cancer Society affiliate in his community. Leading the session with him is Lynn Zakelin, who is a retired school administrator from the New York City Department of Education, a cancer caregiver, and an advocate. Her role as her late husband's caregiver was the catalyst for her work in cancer advocacy, and she and Richard have designed and facilitated groups to discuss the topic we are addressing today on the work of being a patient. So I'm excited to help moderate this session today. I encourage you to engage with us by sharing your questions and stories in the chat box, and Richard and Lynn will prompt you when to do that, and we're going to try to make this session as interactive as we possibly can. And so with that, I'm going to turn it over to Richard and Lynn.
Greetings to everybody. Last year's CPAT meeting, we did a role play in one of the evenings. And out of that, we said we would love to do a follow-up and make it more of a conversation. We'll share some of our thoughts and experiences and go back and forth with people's observations and their own experiences. To put it in context, one of the earliest speakers mentions a strange time, and that's really an understatement in terms of all that's going on between COVID and all the protests and the Supreme Court decisions and racial disparities, etc. And we just began, having put off all of our appointments, starting to go back to the doctors. And so this is coming at a really perfect time to have this meeting, because it was just the last week that we began our journey again. So we really welcome this opportunity and look forward to having a dialogue with everybody.
Do you need to interrupt? Okay. Just to give a little background, Richard lost his spouse at the same time, basically, that my husband passed away from lung cancer. And we met in a bereavement group and had the same interests and became advocates. We started, to give background, the workshop of the work or job of being a patient. Your life depends on it. Came out of all of the work and discussions that we had in terms of when you have a cancer patient or any disease, but there's so many things to do. And we found a lot of it in retrospect in terms of taking notes, in terms of asking for the names of the people with whom you speak when you get, at the doctor's office, researching physicians, getting opinions. Everybody has the best and the best and the best. And knowing when to ask, in terms of schedules. And there were so many elements that were so important in terms of the journey. And when we would talk to people who were first getting into this situation, and I always describe it as being in that black hole and you don't know where to go and how to get out of it and what to do. That's when we felt that there is no description of a job for a patient. And we really felt very strongly that this could be something that that would be useful, helpful, encouraging, and provide that kind of information. With that said, when we were designing this workshop, we decided we would focus more on the components of shared decision-making and the patient perspective, since we have so many, we hope we have so many CUPID attendees to this. And so that's what we were hoping to discuss. And with that, I just wanted to kind of clarify, when we say shared decision-making, we mean a partnership with healthcare providers to make informed decisions consistent with patient values and preferences. And so that's one component. And the other is, again, patient perspective and patient-centered care takes in consideration what the patient is sitting there thinking and what their concerns are. Will I feel sick? Will I be able to work? Will I be able to pay my rent? How is this going to impact my family? Is there a shorter, what are the advantages with my lifestyle and what I do? Which clinical pathway would be the best for me as the individual? So those are that's the focus that we were taking at this point for the job of being a patient. Okay. We're going to do, we kind of have our take it aways.
Love it.
Just my background, many years in the behavioral health field and addiction, mental health. So I have a lot of experience of dealing with patients, and also now I've had the experience of being a patient and the importance of advocacy. And I'm amazed that every experience, every new experience, for somebody who's had all these professional experiences, there's a new wrinkle. There's always something that comes up that we're gonna have to now deal with. And so the simplest thing, which everybody will tell you is crucial, is to bring somebody along on an appointment. That if you're not feeling well or you're anxious, etc., it's very difficult to take all the information that's going to come or have all your questions when you meet with a physician. The anxiety level is sky high. I just went to my cardiologist with this whole thing about 6 feet distance and face masks, etc., and the first time back, and they take my blood pressure and it's 200. So the nurse is like, really, are we going to have a cardiac arrest here? And so she said, let me try the other arm. And I said, no, it's situational anxiety. The next arm is a little lower. Long story short, or as Lynn would say, long story medium. By the time the doctor took it, it was 130. So again, now I'm experienced. I go through all this regularly. So the anxiety, so we had to now deal with, can we both come in together? Well, there's not enough room. There's 6 feet. The doctor, this, etc. Okay, we'll go in. The doctor he heard what we were saying. When we talk about physicians listening, we need to go the next step. So they actually hear what you say and they're willing to make a change. And his adjustment was, and he verbalized it, of saying, we'll sit after I examine both of you, we do the EKGs, we'll sit together and we can discuss all this together. So that was the compromise we came up to. We can give you experiences of where physically I was blocked from a dermatologist going in for Lynn's appointment, a primary care doctor, where they came up that the room is too hot and the room is too small and the doctor doesn't like to do it. So we had to deal with the tech first, and then we had to deal with the nurse. And finally we got to the doctor, and she tried to discourage us. And so this skill of advocating for yourself, communicating what your preferences are, what your needs are crucial. And for a lot of people, they're not comfortable doing this. They don't want to upset the doctor. They don't want to alienate the office staff. And yet, who else is going to advocate for them? So we stress this. What's important to you, and one of the keys we say is to have somebody along that you need to say. That's what you want. You need to negotiate it up front. You need to communicate it in a respectful way and say it's important to me, and be ready. Be ready if the office is not willing to say, we'll go elsewhere. We have yet to be refused. And so it's been successful.
Okay. Well,
let's ask if there are any questions, or
that's...
else we could throw it out for somebody to say, how would you deal with it?
Well, I actually have a quick question, and we'll wait to see if anyone pops up with some questions from the audience. But, you know, I think your point to having someone come with you is obviously an incredible thing that you can do for someone else to go to an appointment with them. What about those people who don't have someone else? Because there are a lot of us out there, you know, who live far away from family, you know, maybe who knows what the situation is, but you really don't have anyone you could ask. How can those people prepare themselves to get through the appointment as if they had someone there? What advice would you offer to those people?
Well, I would, the only suggestion I can make if you don't have someone would be to see if they would allow you to just even record the session and the conversation.
Sure.
I feel that when you go into, whether it's a dermatologist, a regular, you know, whatever physician, you're ready for whatever. It's when there's something that's out of the norm, when there's something that's difficult to comprehend and you didn't expect. I always describe it as it's the Charlie Brown moment. Everything sounds like wow, 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 and you don't really, you can't remember. It's just too much and overwhelming. So you could ask permission to record on your phone, and the other question would be if what we're discussing, will I get in writing to make sure that when you leave, you know that you have the record there to support. And part of it, again, is having, feeling comfortable with your physician. We were ready when we started the new primary care physician, if she said, no, you can't come in the room together, that we would say, well, then we'll find someone else, because it is that important to us that we're able to do that. So that would be, and the other question, if you do have to go alone, to find out before if your physician has a problem with somebody calling, whether you have a son that lives further away, a daughter that lives further away, a physician, a friend who's a doctor, you know, that you feel could make a phone call for you to get any confirmation, or to be able to translate, which is what I was going to go into next.
Yeah.
What's being told.
Great. Would love to hear what your thoughts are on that, Lynn.
So any questions here? Anything we need?
Nothing yet. I will butt in early when they start rolling in.
Okay. All right.
And just a reminder, anyone, there's the chat function. If you hover over the bottom of your screen, there's a little chat button, and you can feel free to put in any questions or even thoughts. If you have an experience that you'd like to share with Richard and Lynn, they can read it and comment on it. So again, we want to make this as interactive as we can. Go ahead.
Also, add one more point, since there are no questions, that another thing which is very important in terms of doing the homework before you go, of the researching and checking the doctors, the insurance that they take, where they're training. They've done fellowship training, especially in oncology. How many years experience, what organizations, hospitals they're affiliated with, asking for if you need extra time. We try to get an appointment right after lunch when there's not backup, or the end of the day, so you'll have enough time to go over any questions, etc.
And if you're getting a new physician, we've tried, since we've moved to a community 4 years ago now, part of it is having all your physicians affiliated with the same hospital per se, because now with everything being computerized, all your data and all, we can go to a physician and they'll say, I see you have an appointment coming up in December with so-and-so, because everything is in there. So if you're deciding and you're weighing between two people, two physicians, that's something else to keep in mind.
And ask questions.
That's key.
And I just noticed with Zoom that people who talk with their hands, it's very good because you don't see your hands flying, because so we're, so the next is another important from the patient's perspective is clear communication. And what I mean is in understandable terms, not, as I would say, medicalese or doctorese. I was in the education field, and I would tell all of my teachers to try to avoid talking teacherese. You quickly say, oh, on the DRP exam or the CAT scan, CAT test coming up, and parents shake their heads and probably go home saying, because all of these, and it was a perfect example with AYA at the previous, where I was on my phone looking at and there's a million things for AYA when you start looking.
Absolutely.
And it's adolescent. So again, doctors frequently will speak in medical terms, assuming that people know what they're talking about. And another thing that I've always said, don't assume that somebody knows, because most people feel intimidated to ask. They think everybody else, I guess I should know it. So you don't want to say, what do you mean by a CAT scan? What exactly is an MRI? What's the difference between a CAT scan and an MRI? An echo and a sonogram, which are the same, sometimes they're used interchangeably. And so just being clear and making it easy to understand is something that's very important for physicians to do. Again, I say it now with PPE and intubation are two things in the jargon now that people probably, for myself, PPE, I looked it up. What was the PPE that was on the news all the time? And now everybody knows what it is, but it wasn't something that was a common. So physicians need to be, think in terms of how they want their patients to be able to go away understanding, which is the point of communication. The other thing is how they express things, a sensitivity or an empathy. And I know that physicians are very busy, and sometimes you get caught up in that kind of, let's get it said and done and quick. And my husband, and again, everybody's got a different personality, and we went for the first oncologist that we went to, said you have metastasized lung cancer, and well, once the cat is out of the bag, there's not much more we can do for you. And the follow-up questions were, well, what about the chemo and how long? And it was, well, you'll be on chemo pretty much, well, you could take a chemo vacation. And it was such a horrific experience. So we then went to a second oncologist who looked at the same information and said, this is treatable. We have lots of different options to try to treat this for you. And it was like just this whole weight, this going forward was so different from the cat's out of the bag to this is treatable and we'll be able to work with you. So again, it's instead of feeling like your life is over, it's live your life. And that's just all in the semantics of what you share as a physician with your patients. Another, again, as I said, that's important, I think, is a written plan, a written treatment plan. So the patient knows what to expect. It includes the details. It summarizes what was, but also what's going forward and what they can look forward to, and not have little surprises here and there. I mean, the last thing when you go to a doctor and you call and you say, oh, I'm feeling, they said, yeah, I expected that. A lot of people, well, it's important for the patient to kind of prepare themselves going forward for good and bad, in that sense. The treatment plan is twofold in that I think it helps for caregivers to
Yeah.
know what's to be done and what to expect and to try to help. And if the patient is in denial, which for example, my husband was, that I had the facts and could go forward and knew where to follow up and what to ask and what to do.
Have you had experiences with the treatment plan specifically? I know there's a lot of people don't get them. Have you had experiences where you've asked for one and there's been pushback from the physician or saying, you know, I don't want to say, I don't know what you're talking about, but that's not something we do. And how would you suggest that people handle something like that?
Interesting. We didn't get when my husband, this was, 16 years ago, and that was not something, and we've learned since then, and perhaps we would have asked. We just went to the dermatologist, one of our first outings. And we told her that we were going to be doing this, and did she have anything to say? And she said, and this was without, she said that physician communications are as important, knowing how to communicate is as important as your medical skills, which include the diagnosis and the treatment. And she said, and then secondly, she said, having the written treatment plan going forward for a patient, she realizes that and then she's saying, and she's wondering, I keep wanting to change what we have written there, and I know it isn't clear enough, and I wanted to add this, and I'm going to add that. And, so she was speaking out loud about the importance that she feels, from just having the biopsy, which includes things like, they're putting creams on, or if it turns red, having the phone, if this happens, call immediately. Having the phone number on that page is something that I think would be important. So you're not, because it makes it easier. If it's right there and it says, oh, if it's a little red, then you can, go forward saying, oh, let me call, it's here, So these are things, and this was just a few days ago, the emphasis on communication and having a written plan for your patients.
Right.
So,
but I have to add, she didn't give us a written plan.
that was the thing, because, well, again, with COVID,
COVID,
it's one, she said, when you leave, she said, call the office because we're trying to keep a pattern. And she didn't want us going back to the front. It was normally they would have had it when you leave and you're speaking to everything is so different now because of the safety measures. So, but those were the 2 points that she suggested.
But also an unbelievable postscript. Friday afternoon at 5 o'clock, you get a call from Dr. Hamilton.
You're not supposed to use the names.
Oh,
go ahead.
yes, it's a positive experience. And she said, I forgot to do the melanoma protocol of asking you, have you had this, if you're tired or you've had pains, et cetera, headaches, et cetera. And she said, I forgot to do it at the appointment. And so I'm following up that I want to have it in the record. And that was a first, and that indicates about the kind of relationship that we've developed together, physician and patient, which really speaks for itself. Do we have any questions yet? Anybody in the chat box?
I don't know. I think we've got we might have I don't want to say a shy group, but everyone is just,
But they're fortunate that it's not in person, because you'd be calling.
Do we have a group?
We'd be calling on people.
That's true. Yeah. No one ever wants to be called on, but yes, just a reminder, if anyone has a personal story they want to share. One thing that I've been thinking about as you two have been talking is, again, going back to having this caregiver with you and the importance of a caregiver. And you seem to have this appointment scheduling down. You have the time of day you do it for certain things. I love that. I never thought about schedule an appointment after lunch because, there'll be less of a wait. And I served as a caregiver for my mom for many years. And I remember the appointments were they were constant, right? And so I, at the time, didn't have a job because that was my job, for 2 years. And so I just think, how do you, what are the ways that you can kind of maximize your appointment time, scheduling them in this different manner for the caregiver so that the caregiver can manage work and the work of being a caregiver to this person.
It's a real challenge. I'm thinking also with COVID of how many changes there have been in appointments and not being able to negotiate a time because the offices,
The slots are
the
limited.
slots are so limited that it's like, take it or leave it. Because the next one is going to be, especially with the dermatologist where I've had melanoma, that I want to be sure I get to see her every 4 months. So if I changed it, so there's very little flexibility. I mean, it really is, and we talk about being strange times.
Yeah.
We talk about being stressful and talk about how you juggle all these things. It really does take its toll.
Yeah.
So when people say they're tired or they're stressed out, it's understandable.
But we never thought of doing it until recently, again, asking on which days is the physician in the latest, or on which days does he start the earliest, as opposed to what's the next appointment time. So if you do feel you need to have somebody, I mean, we're both retired, and so that consideration almost doesn't fit in to people who people who are working and don't have. But that's, again, it's asking the questions, not being intimidated. We find frequently, and I don't know if they train their staff, but the people with whom you speak prior to your physician will try to discourage. I don't know if they protect the physicians, they understand it's, and I would say that if you really share your concerns and your needs, that there is flexibility. We were in a cardiologist's office in California, and we were talking, and there was a knock on the door, and the doctor ignored it. And so then, they're 5 minutes, and there's the same knock on the door. And we said, there's somebody that needs to come in. He said, no, they're just telling me I'm spending too much time with you. Now, it was, again, this, we had we had the relation. It was important enough to be discussing, what it was, but these are the kinds of things that you deal with. Oh, let me see who's it. Oh, yeah, I'm sorry. We're going to have to cut this short now, so.
But there's so many variations on your question. For example, that women always find the time to accompany their husbands. The husbands, for any number of reasons, are not make themselves available to be along. And so it's a matter really, again, of advocating in a relationship to make sure you have somebody come along. We've noticed more younger with elderly people. I've seen more sons recently along, but predominantly it'll be a daughter or a female who will accompany the person.
And that's, we have our session on men in advocacy coming up. I think it's next week, but and that's so important because we need more guys like you, Richard, who are out there advocating. And I think there's, I think there are still many stereotypes about men not being able to handle this sort of stuff. And I think we just need to say, you're human, you're alive, you're in a relationship with whoever it may be, your mother, your daughter, your whomever, your wife, step it up,
And men don't take care of themselves. I mean, more women have skin cancer than men, but more men die of skin cancer related. They don't go. They don't put sunscreen on, so that's an issue.
Well, I think part of it too, you come back to the job of being a patient, and I'm going back to the old stereotypes again, but I think that they're less willing to maybe take time away from work for their physical health. And I don't know if it's biological or what, but I know we women, most of us, I don't know. I want to live a long, long time. So if I feel like something's going wrong, I'm getting to the doctor as
But
soon as.
even with the COVID conversation, that's exactly the same.
Yeah.
Basically, is it economy versus health?
Yeah.
And the decisions being made, whether it's the opening up or when it's time to close again, is based on the economy.
Yep.
Versus what they feel you might need to be doing for yourself. And and that's,
I
Another
think.
thing,
Yeah. Go ahead.
another thing I'd like to share, and again, it relates to COVID, it relates to cancer, that we found people will say, "How are you? How's everything going?" And so it's usually everything's okay or it's all good. And so I did a little study of saying, well, I'm feeling depressed, and see what the reaction is. And it's interesting how many people don't want to get into that conversation. And one of the things I've learned over the period of time is that there are two narratives. And there's one is the medical narrative. And if you'll notice, people are very comfortable talking about who their doctor is, what hospital they're affiliated with, what medications they're on, what treatment they've had, even the prognosis, et cetera. They could talk about it as though they're a physician. The other conversation, the other narrative is about the experience of being ill and talking about, which is part of it, and anybody who's had cancer or any life-shortening chronic illness, the difficult part is dealing with the anxiety, the depression, the worry, the confusion, et cetera, and the pain and suffering. And so you're talking about the medical narrative is about cure and about treatment. The illness narrative is about healing. Mm-hmm. And so as we were walking, we encountered a woman who asked her how she's doing, and she says, my depression, I just can't shake it. And so we wound up having this little conversation about she had surgery before COVID and then being isolated and having to do telemedicine with a psychiatrist and different medications. And those conversations find very rarely that a physician is either willing or able to engage a patient. My favorite story is my cardiologist. I'd had a heart attack in 2015, and my follow-up when I saw my local, I had the heart attack in London, my follow-up here with my cardiologist, who asked me how I am, and I said, physically I'm fine, but after you've almost died, your mortality is really front and center, and it's kind of scary. With that, he got up and left the room. And so I said, I really was annoyed, and I said, wait till my next visit, because I'm going to get Dr. W, and we're going to talk about this. So the next visit, and I said, you remember the last time I was in? And I said how I was feeling, and you got up and left. And I said, all I needed from you was some empathy and to say that's usual for people who have had a heart attack. And I think it would be the same thing of you've had a diagnosis of cancer or metastatic cancer, et cetera, and you're feeling overwhelmed. And the easy way out is to say, well, we could see our psychologist, or we can make a referral to a psychiatrist, or to say, let's sit down and talk about it. And I'm able to listen to your concerns and your feelings. I didn't need a psychiatrist. I just needed somebody
validation
to
Absolutely.
empathize and show some compassion to what I was feeling. The next visit was 45 minutes. He sits down and he says, okay, let's talk. And I said, and we wound up having this really great conversation about mortality and about none of us live forever. Mm-hmm. And he was smiling and I was smiling. But again, the patient has to be willing to say, my perspective wasn't considered. My perspective is important. My feelings are important. Let's have that conversation about illness, not just about medicine.
Absolutely. Well, I think that's really critical. And we hear that a lot from people who've been diagnosed with cancer, that they wish they knew it was normal to experience the anxiety and the depression, and they don't know that. And so they don't talk about it, and then it becomes worse. And, you know, the long range anxiety with survivors, it's long lasting. It's not something that goes away when, you know, if you're lucky enough to stop receiving chemo and get into a remission state, it's not over, all of that anxiety. So I think that, and couple that with the fact that most people trust their doctor, right? There is a lot of, you know, maybe not the advocates, or many people who are watching this who are really good self-advocates, but the majority of cancer patients in the United States are not self-advocates, and they trust their doctor. So when it's someone that you trust and they're not opening up that conversation or acknowledging that, it's very worrisome. So Richard, we need to figure out how everyone gets to have a conversation like the one that you had, without being as great of an advocate as you are. So I think hopefully you taught your physician something that day. It sounds like you did.
The only thing I left out, which we like to do, is to say, "How about a hug, Doc?" I don't think he was ready for it.
No,
and that's something, just as a side, that's something that's really missing now. And we did it with the dermatologist the other day. We said we'll have to do air hugs, because that missing a touch is so. I mean, this virtual is great and it's a way to communicate, but we all miss the touch and also being touched.
Absolutely. I think, and I just want to remind people, if anybody watching has had an experience that you'd like to share and have comments on from Richard and Lynn, you can feel free to type it in the chat box. But I do think that's one thing, hugs and handshakes and all those things, to be determined where we will end up in the future. But it's very difficult to see people around that you've known, and I was never a hugger, but then you become a hugger as you work in this field, and you know, it's like you're hugging everybody, and now you kind of have to walk that back. So it's an interesting take.
Can't even high five anymore.
No, I guess maybe that elbow thing is still going on. I'm not totally
Unless
sure.
you have very long arms. It's not.
But you know, I think it would be great if you guys could provide, like, how do you open up those conversations with your physician about something like that? You know, Lynn, you talked about, you know, you kind of have to be brave to, you know, have these conversations. How can you kind of start that for someone who maybe doesn't feel brave, or, you know, what advice might you give them to open those dialogues with their physician?
Well, we were also going to share something about illness beliefs. And one of the biggest, we want to say the old belief is that, you know, your doctor knows best. And people hesitate to question. And we feel very strongly that if you're not comfortable enough to share something that you take home with you that could be festering, then you need to either open up to the physician, or you're going to need another doctor who you do feel you can openly talk with and share how you're feeling. Because as Richard said, it's not just treating an illness. It's not the diagnosis and treatment of a disease. The illness is the person. And every person is individual, and every person is different. And there are a number of people that maybe would not need the kind of conversation, or would have just walked out of the office and not been quite as upset as Richard was, having opened up, you know, how he was feeling, because part of the was just the vulnerability, having had this heart attack and not knowing what to expect. And even when we were speaking with this friend, we had this conversation. You almost wonder, are you the only one? And that's what being able to speak to a physician who sees so many people and so many patients that have similar reactions, can say, no, this is something, and if it continues, we know how we can address it. And that's all you might need. It's like I had a friend whose husband had to take it to the hospital, drive it to a hospital before her panic attack would end. And then she'd say, no, I don't need to go in, I'm okay. And he knew, he just had to get her in the car, take her to the hospital, be in the parking lot, and she would be fine. So again, this is each person's individual, and the physician has to acknowledge that. And if they can't, sometimes they're not the right physician for you.
I think that's a great point, and being willing to try someone new, and understanding that the physician relationship, especially when you're in such serious disease states like cancer or dealing with heart attacks,
no question is insignificant.
Absolutely.
And if it needs to be asked again because you don't remember a response, it still needs to be asked, and not feel intimidated.
Absolutely. We do have a comment here from one of our audience members, just saying that when they've been on telehealth appointments, they've gotten the sense that some of the providers are just as lost as patients on how to practice medicine over webcams. And have you guys had any experiences with that during this whole thing?
No, not yet.
We didn't have to, because both with the case with this new cardiologist who, we felt we needed to get a new one where we are, because if something should happen, our other cardiologist, Dr. W, is a long drive away. And so we couldn't do anything, because this was our first intake, first meeting, first appointment. And then the second physician we felt we needed to do was a dermatologist, which again, having the melanoma was not something we could do on so we really haven't had an experience of having a physician. The next thing is going to be dentists, and that's again not going to be done with telemedicine.
Well, yeah, I know dentists are hard up, because my dentist called me to try to get me to come in, because I said, well, I'm just going to keep people's hands out of my mouth for unless I have a major problem.
Correct.
For the foreseeable future if I can. But I think that's great that you guys didn't have to go through the telehealth. We've been conducting focus groups about telehealth and cancer survivors and how they're dealing with it. And I think the reviews are mixed, because there is that sense of fear around not having the physical exam, like you were talking about with the dermatology.
Correct.
You can look at someone and you can have a conversation, but if they're not touching you and feeling your body, or maybe getting those blood work results, there's still a lot of fear there. So it'll be interesting to see what happens, how much telehealth plays a role in all of our futures. Or
I think right now, one of my biggest concerns is the preventative or the ongoing care, which, as a cancer patient is something you can't just say, we'll hold off on doing something.
Right.
As we laugh about, going to a dentist, if your teeth aren't bothering you, so just do extra flossing and you'll get it cleaned a little later. And it's not the same thing now with something that you really need to have a physician monitor.
Absolutely.
So if it's just questions, we did have, the telemonitoring, as I said to you, sometimes it almost seems more intimate. You're close up and you can share. There was an article in the Times about, it was, I think the bathroom was the new couch, where it was the only private place in the house to have your conferencing. And so, it was that kind of thing. So.
Also in terms of people taking this seriously, that this is a job, it depends also on your illness beliefs. And we define a belief as what you believe in your heart of hearts to be true and valid for you. And we found that there are constraining beliefs and there are facilitative beliefs in terms of how you manage your health. And so if you believe that it's your job, it's your responsibility to deal with these uncomfortable things, whether it's asking your doctor for more time, asking for a written plan, asking for a specific appointment time. If your belief is that that's going to help you manage your illness more effectively, that would be a facilitative belief. If you feel that it's not going to make a difference, you're speaking up or following instructions. We did a presentation for urology residents at Yale. And one of the residents said, when we talked about beliefs, he said his father doesn't believe medications are effective. And so he cuts the medications in half. And then he's got proof. He's got proof that the medications don't work. And that really is a great example of how your beliefs, and that gets passed down from your family, family's customs and values, you know, how you grew up and your friends. And then if you start thinking, let me sort it out. Is that a constraining belief? A friend of mine believed that he should only go to the doctor himself, and he didn't want his wife involved. He didn't want his family involved. And for him, it worked in that he didn't have to explain, but in the end, he alienated his family and he wound up dying alone. It's a very sad story.
Yeah.
And yet, if you believe facilitative beliefs, as we said earlier, about bringing people along, whether it's a friend or a family member, if you believe it's important to ask for what you need, again, it's a facilitative belief, your needs get met, etc. So we raise that question to think about what your beliefs are. What do you really, in your heart of heart, believe is going to work for you, and distinguish between is it working or it's not working.
We were going to pose a question. One would be, if you, to the future physicians, if you have a patient who does not believe that wearing a mask or keeping the 6-foot distance works because nobody in their family and none of their friends have come down with COVID, so what's the point? How would you go about sharing it? And that's, it's not a very facilitative belief to have the one that says, well, if it didn't happen, you know, then I guess it's not real, that kind of thing.
Right.
You know, and Caitlin, when she was sharing earlier, when she felt she had 2 young children and it was better just to make up stories and not give the real facts. And that would be you know, as it worked out, might be interpreted as constraining, and giving them the facts and having them face the reality on their age level where they could comprehend it would be more facilitated. Yeah. So again, that's very significant in how you handle your health management.
Yeah, I've not heard of these facilitative beliefs. I like that. I'm gonna have to, you know, look into that more, because I think it's really important to help give people just simple tools to figure out, because your human nature kicks in in times of crisis, and, you know, back to the whatever days when we just fight or flight, you know. So I think a lot of people really don't even realize that they're, you know, making these choices that might end up being detrimental to them in the end, because there's another choice. And I think in terms of the mask, I'm not a physician, but I would recommend, I saw this thing on Vox where they gave an overview of people sitting in a restaurant, and they weren't wearing masks, and it showed how the infection spread very easily to anyone in the AC system line that they were in. Sure. Yes. And I think that it both made me remember why we're wearing masks, but also gave me a little bit of confidence to go out, because I think that's one of the things too. And with people going to the doctor, you don't even having the confidence like you all did to go to an appointment. I mean, that's with long-term cancer survivors who maybe aren't seeing an oncologist anymore, but they do have these other healthcare needs that they need to continue to monitor, making sure that now that we're open, you wear your mask, you go to those appointments, those checkups.
And if there are multiple office facilities, if you can avoid the one that's in a hospital and you go to a physician's office that's just in a separate building, and if you can find out if the physician will have you wait in your car, and you can call and just take you right into the examining room as opposed to having to wait in a waiting room. Oh. Those are all questions to ask prior to even going to the appointment, if that's something. And if they're not doing it, would they let you do it? If you,
Great
you know,
point.
again, not having to handle paperwork or giving your cards. If there's any information they need, can you just give it to them now or over the phone, have it done online, so you don't have to sit in the office and start writing things. And, you know, everything that's now, you know, less is better, and that
Yes.
kind of thing.
Well, I think that all these things are great tips. And as we wrap up here, you know, I can't keep a lot of things in my brain at the same time. So I want to end with asking each one of you to give me your number one tip or your number one secret about the job of being a patient. So I'll put you both on the spot. You've given a lot of great advice. What's the most important to for each one of you?
Well, I had to sum it up. I'll give you 4.
Okay, 4. I'll see what I can do.
Alignment, basically aligning care with the personal values and needs of the patient, is one. Treating the patient with respect and validation of their concerns and their opinions. Communication in understandable terms, expressed compassionately, and with a written plan to follow up. And giving the patient choices with explanations and the best outcomes for them.
Love that. Thank you, Lynn.
Mine will be very simple, and that is to be willing to advocate and speak up. I could give any number of examples of doing that, and that the physician or the staff member responded in a positive way. And that is also a great test of if this is somebody you want to work with.
Sure.
The last vignette, my wife was in treatment, and the oncologist was not available. He had to teach a course, and we wound up waiting till 5 o'clock, and the office closed, and he still didn't see us. And we went down, we knocked on his door, and just kind of brushed us off. My wife, who was kind of an easygoing person, sat down and wrote him a letter, talking about her life was on the line and what she expected of him. And he was not famous for being an easy person to deal with. And to his credit, he acknowledged that she was right, and he changed in terms of how he was available to her.
Wow.
And the story is interesting in that 20 years later, we find that he's at Yale, and I had an opportunity to remind him of how we knew him.
Oh,
and
wow.
to give him the feedback of the fact that he did make a difference by changing.
That's
So
incredible.
you always have to give it that extra try for yourself, your own sense of worth.
Well, I love that, Richard, and thank you for sharing that personal story. I think that us, you know, as patients, opening up a little bit to our physicians and letting them in to see whether they're asking to come in or not, you know, kind of force them to come in to see who we are as people and all that we need to live for, and giving that little personal piece of yourself. So I appreciate
Great summary. Great summary.
Well, I've loved having this time to chat with both of you, and thank you so much for teaching us about the job of being a patient. It's probably the hardest job of most people's lives, so we appreciate that. And for everyone who's watching, we're going to have closing remarks back in the main area, so if you go to your email from this morning, you can click on the main link there, and that will take you back to the main session where Shelley is going to offer some closing remarks to us.
And this was like a bonus visiting with you.
Thanks.
I enjoyed it.
This is great.
You guys have a great day. Thank you so much.
Thank you.
Thank you,
Stay
everyone.
safe.
You too. Bye-bye.